Which of the following is an example of lower respiratory tract infection? Option A sinusitis, option B laryngitis, option C bronchitis, option D rhinitis. The correct answer is option C bronchitis. Bronchitis affects the bronchi of the lower respiratory tract and causes inflammation and mucus buildup. The exchange of gases between lungs and blood occurs through option A osmosis, option B diffusion, option C active transport, option D filtration. The correct answer is option B diffusion. Gas exchange between alveoli and capillaries occur by simple diffusion along concentration gradients. Which of the following conditions is caused by inflammation of the larynx? Option A laryngitis, option B bronchitis, option C asthma, option D pharyngitis. The correct answer is option A laryngitis. Laryngitis causes hoarseness and loss of voice due to inflammation of the laryngeal mucosa. The respiratory center is influenced by option A blood pressure, option B pH of blood, option C glucose level, option D temperature. The correct answer is option B pH of blood. The medulla respiratory center responds to changes in the blood pH caused by carbon dioxide accumulation. Next question. Which cells secrete mucus in the respiratory tract? Option A ciliated cells, option B globular cells, option C alveolar cells, option D endothelial cells. The correct answer is option B globular cells. Globular cells in the respiratory epithelium secrete mucus to trap dust and microbes. The next question. Which of the following is the site of voice production? Option A larynx, option B trachea, option C pharynx, option D bronchi. The correct answer is option A larynx. The larynx contains vocal cords that vibrate during exhalation producing sound. The larynx contains vocal cords that vibrate during exhalation producing sound. Which of the following prevent friction between the lungs and thoracic wall? Option A pleural fluid, option B synovial fluid, option C mucus, option D pericardial fluid. The correct answer is option A pleural fluid. Pleural fluid in the pleural cavity reduces friction during breathing movements. The next question. What is the main function of epiglottis? Option A produce sound, option B close the trachea during swallowing, option C filter air, option D warm air. The correct answer is option B close the trachea during swallowing. The epiglottis prevent fluid or liquid from entering the airway while swallowing. Which process occur when oxygen moves from alveoli into blood? Option A active transport, option B diffusion, option C filtration, option D osmosis. The correct answer is option B diffusion. Oxygen diffusion diffuses from the alveoli high concentration to capillary blood low concentration. Which respiratory disorder is characterized by narrowing of airway due to inflammation and mucus? Option A asthma, option B tuberculosis, option C pneumonia, option D bronchiectasis. The correct answer is option A asthma. Asthma is a chronic condition with airway narrowing due to inflammation of mucus secretion. The term hemothorax refers to option A air in pleural cavity, option B blood in pleural cavity, option C pus in pleural cavity, option D fluid in pleural cavity. The correct answer is option B blood in pleural cavity. Hemothorax is the accumulation of blood between the pleural membranes often after trauma. The main stimulus for respiration in healthy individuals is option A high oxygen, option B high carbon dioxide, option C low nitrogen, option D high bicarbonate. The correct answer is option B high carbon dioxide. Chemoreceptors detect high carbon dioxide levels and stimulate the medulla to increase respiratory rate. The lungs receive oxygenated blood from option A pulmonary arteries, option B pulmonary veins, option C bronchial arteries, D aorta only. The correct answer is option C bronchial arteries. Bronchial arteries supply oxygenated blood to lung tissue for nourishment. Bronchial arteries supply oxygenated blood to lung tissue for nourishment. The trachea is lined by which type of epithelium? Option A simple squamous, option B ciliated pseudostratified columnar, option C simple cuboidal, option D transitional. The correct answer is option B ciliated pseudostratified columnar. This specialized epithelium traps and moves particles out of the airway using cilia and mucus. The next question. In which condition do alveoli become enlarged and lose elasticity? Option A asthma, option B emphysema, option C pneumonia, option D tuberculosis. The correct answer is option B. Emphysema. Emphysema causes destruction of alveolar walls, reducing gas exchange surface and elasticity. The next question. The conducting zone of the respiratory system includes option A alveoli, option B bronchi and trachea, option C capillaries, option D blood vessels. The correct answer is option B, bronchi and trachea. The conducting zone includes airways that transport air but do not participate in gas exchange. The next question. The respiratory center is located in the option A cerebellum, option B cerebrum, option C medulla oblongata, option D thalamus. The correct answer is option C medulla oblongata. The medulla oblongata regulates respiratory rhythm and rate automatically. Medulla oblongata regulates respiratory rhythm and rate automatically. The process of moving air into and out of the lungs is called option A ventilation, option B diffusion, option C perfusion, option D oxidation. The correct answer is option A ventilation. Ventilation involves inhalation and exhalation to facilitate gas exchange. Ventilation involves inhalation and exhalation to facilitate gas exchange. The left lung contains option A 3 lobes, option B 2 lobes, option C 4 lobes, option D 1 lobe. The correct answer is option B 2 lobes. The left lung has only 2 lobes, superior and inferior, due to space for the heart. The next question. Which of the following is a sign of respiratory distress? Option A regular breathing, option B pink skin, option C use of accessory muscles, option D normal pitch. The correct answer is option C use of accessory muscle. Accessory muscle use indicates labored breathing and difficulty maintaining adequate ventilation. Next question. Which structure filters, warms, and moistens air entering the respiratory system? Option A trachea, option B nasal cavity, option C bronchus, option D larynx. The correct answer is option B nasal cavity. The nasal cavity is lined with mucous membranes and cilia that traps dust, warm, and moisten income air before it reaches the lungs. The next question. The respiratory center that controls the depth of breathing is located in the option A cerebellum, option B medulla oblongata, option C hypothalamus, option D pons. The correct answer is option D pons. The pons regulates the depth and smooth transition of breathing, working with the medullary centers. The next question. Which of the following conditions is characterized by recurrent airway obstruction and wheezing? Option A asthma, option B pneumonia, option C tuberculosis, option D emphysema. The correct answer is option A asthma. Asthma involves reversible airway obstruction due to inflammation and muscle spasm, leading to wheezing, shortness of breath. The pleural fluid functions to option A reduce friction between pleural membranes, option B supply oxygen to the lungs, option C absorb carbon dioxide, option D protect lung from infection. The correct answer is option A reduce friction between pleural membrane. Pleural fluid act as a lubricant between the visceral and parietal pleura, allowing smooth lung movement during breathing. Which structure connects the larynx to bronchi? Option A pharynx, option B trachea, option C alveoli, option D bronchioles. The correct answer is option B trachea. The trachea or windpipe connects the larynx to bronchi and serve as the main airway passage to the lungs. Thank you all.